The Era of Novel Pathogens by Alexandria Olivo, D.O., Farah Salim, M.D., and Jimmy Chua, M.D. Ergatella lenta is an anaerobic gram-positive bacilli associated with immunocompromised hosts, polymicrobial intra-abdominal infections. E. lenta has a high fatality rate of 22 to 43% mortality. It is usually resistant to penicillins and piperacillin tazobactam, otherwise known as Zosyn. Our case presentation includes a 74-year-old female with underlying Crohn's disease who's on infliximab. She has COPD and uses 3.5 liters for home oxygen. She presented to our emergency department with abdominal pain and septic shock due to a sigmoid perforation that was documented on CT scan. The patient was admitted and she has had an explanatory laparotomy with resection of the sigmoid colon and formation of a colostomy, which you can see below in a Hartmann pouch. She was empirically treated with vancomycin and piperacillin tazobactam. After her XLAB, the patient developed loculated intra-abdominal fluid collections. This required ultrasound-guided aspiration, and the patient subsequently developed severe protein-calorie malnutrition. Next, patient had positive blood cultures, which were identified as gram-negative anaerobes. The treatment continued only on Zosyn, and vancomycin was discontinued. The patient had a poor clinical response with this intra-abdominal fluid collection needing aspiration, anemia, and persistent leukocytosis. The patient was then found to have Ergatella lenta on hospital day 7 in 2 out of 4 bottles. Initially, susceptibilities were not available, so antibiotics were changed to meropenem. Patient was discharged on hospital day 27 due to slow improvement. In follow-up, she was seen in the infectious disease clinic after discharge. There, due to the slow improvement, patient continued on another month of meropenem. She also developed a post-op efficium in coag-negative staph that was treated with IV vancomycin for 18 days in the outpatient setting. Eventually, her wounds closed and patient is now doing well. So, Ergatella lenta is a novel anaerobic, non-sporulating, gram-positive bacillus which is probably underreported in clinical settings due to difficulty in identification, due to long incubation time, and difficulty culturing and identifying due to its more intensive methods of speciation. Notably, E. lenta is associated with polymicrobial intra-abdominal infections. The 30-day mortality rate was 36% in a retrospective review of patients whose source of bacteremia was primarily abdominal. Risk factors include states of immunosuppression, like our patient who had Crohn's disease and was on infliximab, patients with malignancies, and patients with irritable bowel disease. Currently, no clinical guidelines exist, but literature review revealed it is usually resistant to penicillin and piperacillin tazobactam, and susceptible to vancomycin, carbapenems, and metronidazole. Thank you for listening to our presentation on Ergatella lenta.